So I forgot to make an intro for this video, but this is gonna be a good one. We're gonna be interviewing a plastic surgeon, spending a day in the life with him, so I really hope that you're gonna be blessed and that you learn a lot about this specialty. So let's get started. So who are you?
Hello, I'm Dr Darius. I'm plastic surgeon from Lithuania. I'm already about 10 years working in the surgery and plastic surgery.
Okay, perfect.
Dr. Darius is a young plastic surgeon from Šiauliai, a little town in Lithuania. He's a disciplined professional, a loving husband and father, and I'm very blessed to say that he's one of my mentors.
Why did you want to become a doctor?
When I was young, I really wanted to help the people, and I started to become like a surgeon and have a practice for 4 years in that part, and after that I have a possibility to change my specialty and I became a plastic surgeon. After that I decided to help people to change their body, and of course with that you are changing and their lives also, and psychology.
Nice. So why did you want to become a plastic surgeon?
So I'm changing my specialty after the surgery because I wanted to change the bodies of the people. Of course, with that I'm changing and their minds, their psychology. We are starting to change and their lives, more healthy lives and so on. And I like to do that.
Nice. Men and women?
Yes, doesn't matter. It's coming or man or woman. Of course, at these days it's more women, but we are doing it for men, all different kind of surgeries and of course procedures.
What is your favorite thing about your job?
My favorite thing, I think, that when you are doing the dressing on next day and the patient are seeing the results and we are crying of happiness tears, so it's really the best thing, I think, what you are seeing from the plastic surgery.
Yeah, it's very comforting, right?
Yes. To do the best to treat that complications, but after the dressings, when she's seeing a new body, a new breast or so on, so we are crying sometimes and you are smiling and yes, I done the best what I could.
So, doctor, what are you specialized in? What is your specialty in plastic surgery?
Mostly I'm doing a body contouring. Of course, for men and for women it's different things, but for women more breast implants, reshaping of the body with liposculpting and Brazilian butt lifts, tummy tucks. With men's more it's about liposculpting of 360 of the tummy and waistline. Of course, gynecomastia removal, and for face we are doing blepharoplasty, some injections and forehead lifts.
So, doctor, what are the values that a plastic surgeon should have?
Good question, Sophie. In my opinion, all doctors maybe should have privacy, counselor, and of course to be an artist, to make bodies like sculptures.
Why should a plastic surgeon have the value of privacy?
Because it's very important. You're having people who are coming from all the world. We are seeing what problems we have, why we have that problems, and you need to decide to say that you can correct one or another things, and it's very important that if she don't want or he don't want, it should stay in the room where we talked about that.
Because it's like their private business, right? Like
yes,
their body.
It's private business, it's their own body, and you can't say, I'll show for everyone. If some people likes to show their body, how it changed, yes, everything is okay. So it's very important that if people don't want that, that all information what it was talking about wasn't go out from our room, so it will be safely staying in our minds and in this room.
So basically you can tell me like you need to, because some people feel bad about their bodies.
Yes,
you
all
know?
people feel bad.
Yeah.
Even I.
Even you?
Yeah.
You, doctor?
All we have some disproportion of a body, something. So all people have something what they would like to change. It's not.
Yeah, so it's important for you to like get into their shoes, right? To be
Yes,
able to
of course.
empathize.
Yes, of course, because some are coming with face problems, some with body problems, some with mental problems. So you need to decide what the problem is and to sort it out. So it's very important.
So it's very important to counsel them and advise them.
Yes. Also to show how it can be before, how it is before and how it can be after the surgery, after some injections and so on. So it's really important to counsel everything. And last thing, for what reason plastic surgeons should be like artists, please come, I'll explain. So first of all, we need to do pictures for of the body, of the face. It doesn't matter what part of the surgery you are doing. You need to do pictures before. Well, for what reason? Because after you make an creation of your body sculpture or face contouring or something like that, you'll show how it looks before and after. It's very important. And when people are coming after 3 months, when you already seen the results, how he looks after, we are smiling, sometimes crying, but for that reason, of joy, yes, of joy. So for that reason, it's very important to do photo before and after.
So it's very important that you work in a team, right?
Yes, that's true.
So if I'm a patient, what do I have to go through after getting my plastic surgery?
So first of all, it's consultation. It doesn't matter how you want to do it. It can be online, or if you'll come to our country, so we'll do a real consultation. In that consultation, we are deciding what you want to do, what you want to change. And of course, I'm explaining everything about all the surgery, what it will be and how it will be. After that, if everything okay, we are deciding the time. So my assistant helps with that. And when we'll decide the time, you are coming to us already. So it depends from what kind of a surgery we will do. If it will be tummy tuck, so we'll stay in our hospital for 2 days, but if it will be breast enlargement, so it will be only 1 day. And of course, my team is preparing for everything. So we are checking about if it's necessary, what implants we need. So we are deciding what implants, and we are getting from our warehouses. And most important part, it's a surgery room and all my team in it. So anesthesiologist who put you in sleep, of course my assistant who helps me with the surgery, and all the nurses who helps also with all the surgery. After that you will wake up in the room, the nurses will take care of you, will give you painkillers, everything. So you will be taken care of everything what is necessary.
It's been such an incredible blessing being able to spend the past month with this doctor. He's my mentor, and I sought out for help from him because I didn't know what specialty I wanted to choose. And this leaves me with the last tip for you guys, which is always seek for help. Never be ashamed of showing that you don't know what you want to do or you have difficulty in doing certain stuff. Always seek for help, and you will find those answers. Find yourself a mentor.
Wow, thank you so much for all the value that you're giving us so far. So what advice would you give to medical students that are struggling with medical school?
So I would give, of course, first of all, be patient, because it's very important, and take your dream. How I said, for 3 years I was like simple surgeon, and I decided to have my dream and to be a plastic surgeon. So always dream what you want, always do for that dream everything what it's possible to do, and you will be the best in your specialty.
Exactly. It's so important to be consistent and always be blessed. Bye.
Bye.
Okay, that's it.
So have a good weekend, guys.